Hi, this is Jimmy Phillips, and we are back taking you behind the scenes at Kettering Health Network as we respond to this COVID-19 crisis. And we've taken you all over the network so far. We want to start to go inside of our facilities. I'm here with Mel Crawford, who is our Network Director of Environmental Services. Your team is responsible for keeping the facilities clean. And this includes our patient rooms. It also includes general areas. Give me an overview of what your team does on just a daily basis.
We make sure that our first priority is the health and safety of everybody that comes into our facilities. I think the biggest fear that people have coming to a facility is cross-contamination, coming to a place where people are sick. And so by having it clean and orderly, it alleviates those fears, and it certainly adds to their healing. We want to make sure that environment that they come here to be treated in is also an environment that they feel comfortable in, and that we're supporting the outcomes that medical care is being provided to them.
Your team is just as much at the front lines as our doctors and nurses, because they're going into patient rooms and actually cleaning and making sure that they're sterilized as they go from patient to patient. How has the COVID-19 crisis changed the work that your team does normally?
Well, it certainly has sharpened our focus in making sure that we're directly targeting high-touch areas and making sure that we're disinfecting with chemicals and processes that align with the CDC's requirements. This is something that we do all the time. We fight C. diff, we fight all types of viruses and bacteria every day, and we don't think anything about it other than to make sure that we're safe in the process of doing it. So this is a little different, obviously, because it's new, it's unfamiliar, but ultimately it's something we've just practiced every day that we do.
Have any processes or protocols changed for your team in terms of what they wear when they go into certain rooms or anything like that?
The precautions are different in the sense that we have people who are in isolation that are either airborne or have isolation for droplets. And so their PPE is going to be a little different. We've increased a different type of chemical that we're using Electrostatic Spring. It's a Clorox product, and it really does do a great job of blitzing a large entire area like this waiting room. And taking a lot less time to do. One of the things that we're doing is focusing on our nursing areas, because they're obviously doing so much, and we need to care for them and making sure that we're taking care of their work areas, their break areas, and pulling extra trash and waste from those areas. Because we're developing a lot of PPE from that, and so by making sure that they see us and that we're responding to their needs, we really feel a sense of purpose.
What is something you wish people knew about the work that your team does that maybe they don't know?
Well, I think they don't quite realize the millions of square feet that we have to take care of every day. That despite sometimes the challenges of having variable staffing models in place, that it's still the square footage that we have to take care of, and yet we figure out how to get it done. Housekeeping teams, not just clean, but they are a big role in customer service. They visit our patients, 15 minutes of a day, and they have to make an impact for our patient experience.
Well, Mel, thank you so much for spending a few minutes with me today. And Facebook family out there, drop us a line in the comments on this video thanking the incredible team members of the Environmental Services Group. They're keeping our facilities clean. That means keeping you safe, keeping your family members safe, and keeping our staff safe. This has been Jimmy Phillips. We're taking you behind the scenes at Kettering Health Network as we continue to respond to this COVID-19 crisis.